Before I begin my report, can I also echo the words of the Premier? I would like to express my apologies for the impact of the mistakes on the health and wellbeing of the community. We have seen 7 new cases of COVID were diagnosed in the 24 hours to 8 p.m. last night, bringing the total number of cases to 3,768. There were 10,806 tests reported in the 24-hour reporting period. Of the 7 new cases reported to 8 p.m. last night, 6 were locally acquired and 1 was a traveller in hotel quarantine. 3 of the locally acquired cases are close contacts of cases linked to the Chopstix Asian Cuisine at Smithfield RSL. 2 are close contacts of a case linked to Our Lady of Mercy College, whose source is still under investigation. 1 case that I've just referenced attended the Sydney Girls High School at Surry Hills whilst infectious on the 6th, 7th, 10th and 11th of August, and the school is closed for cleaning and will reopen on Tuesday the 18th of August, and contact tracing is underway. Another case worked at the Parramatta Local Court, and the person last attended the Parramatta Local Court on Wednesday the 12th of August, and the positive result was received on Saturday the 15th of August. As a precaution, cleaning of the courthouse took place on Sunday the 16th of August, and all close contacts have been identified and are being contacted. Some of the information that we've received recently is that people are tending to think that their illness is influenza. They're saying, oh, it's okay, I've got flu-like symptoms, I must have influenza, I don't need a COVID test. It is essential. At the moment, we have very low rates of influenza circulating. So if you have symptoms, respiratory symptoms of cough, fever, sore throat, runny nose, headache, aches and pains, it is most likely that you have COVID, not flu. And so it is essential that people don't just think, oh, it's influenza or it's another respiratory virus, and come forward to testing. As the Premier indicated, we are concerned that there are low levels of transmission still occurring, particularly in areas of Western Sydney and Southwestern Sydney. It is essential that anyone with symptoms, particularly in those areas, come forward for testing to allow us to stop any further transmission. Every day we are identifying 1 or 2 cases of unknown source cases. Also reflecting on the Premier's comments, I have written to education, and that is across the government and non-government schools, to provide updated advice about and clarification into terms of those activities that need to cease for the next 6 weeks. We will reassess this advice in light of where we are in terms of the COVID pandemic at the end of term 3. I would also like to echo my appreciation for the engagement with the non-government and Catholic school sector, and also our education sector in adopting these measures. So in summary, they relate to preventing or minimising any mixing of students from schools in different regions, and that may occur as related to sporting-related activities, but other activities in schools. We're having a particular focus on stopping singing or chanting activities or the use of wind instruments in groups, and that is because we have increasingly become aware around the way that droplets and aerosols can be generated by those activities. Also, school-related social activities, school formals, dinners and dances and graduation ceremonies or parent engagement functions should cease, and also school-related overnight events such as retreats, camps, excursions, as there is obviously an increased risk of transmission in these residential type exposures that are a consequence of those activities. Thank you.